Good evening, all the aspirants present here. Well, today's topic is infectious disease tropical medicine. Have here is Dr. Anand Joshi. He is a consultant intensivist and physician at Government Hospital, Hyderabad. Sir, you may take over. Thank you.
Good evening to all. Welcome to another session of infectious disease and um, microbiology, which are medically relevant. Um, we this will These are going to be a series of lectures, which I will try to cover most of the infectious disease related topic. Um, uh, so this will be the first one, and subsequently we have other different diseases which we will be covering in subsequent talks. I always say this, that humans are very smart organisms, but we know that we know, or rather we think that the humans are very smart organisms, but we forget that we are not the first one to come on this earth. The first unicellular organism is assumed to be started from the viruses that gets bit complicated with fungus and then the bacteria. So bacteria, virus, and fungus are the three forms of living organisms. And remember, all these three organisms survived all the Stone Age, Bronze Age, even the mighty dinosaurs came and got vanished. However, bacteria, virus, and fungus remained the same. The last probably to come were humans. And we humans, if we think that we can rule this world by eliminating all the living organisms, then I think we have to rethink our intellect. These are the virus, bacteria, and fungus are the organism that has survived everyone. So if we think that we can eliminate all of them completely, then probably we are not being realistic. This first talk, I'm going to cover what we call it as a medically relevant microbes and antimicrobial classification. In this, I'm going to just give a complete overview of important medically relevant bacteria, virus, and fungus. Of course, we do have protozoas and other parasites, which are it will be too large and it is out of the scope for this current talk. I'll be covering them later. Now, for these bacteria, virus, and fungus, when they enter into our body, it's always the survival of the fittest. If you see in the Darwin's theory of evolution, or even if you see, there always been a survival issues with any of the organisms. Every organisms need food, and they thrive on other organisms or the living thing for staying alive. And that is also true for bacteria, virus, and fungus. At the same time, each organism has a right to defend and try to kill the other organisms. So hence, the defense or the immune system of the humans come into the play. So when we say that we are infected by some organism, particularly now we will be talking about bacteria, virus, and fungus, we are talking about the entry of this organism inside our body. Now, when these organisms enter, obviously the immune system is trying to defend, and in this process of defense, whatever the sign and symptoms develop, that is how we recognize that somebody has entered into our body. Our body, including the skin, is all inhibited at some point of time with some various organisms. Our oral mucosa, our nasal cavity, some organisms stay there, but they stay with a symbiotic region. When they breach the barrier, and the first barrier being our mucosa and our skin, and enter into the system, that's when the problem starts. Now, we've been here for thousands of years, and there we have seen that whenever this infection enters into the body, they tend to kill the humans, and the humans die. So to counteract them, humans anti uh, discovered antibiotics for the bacteria, or antimicrobials for bacteria, virus, and fungus. So we have bacteria, and we have developed antibacterials for that. We have virus, and we have antiviral for that, and we have fungus. We have antifungal for that. While these sound to be very, very, very basic thing, the reason I'm insisting is that you stop yourself and just look around, or see what you have done in the recent past, or you have seen some around. You'll always come across certain things like, oh, he's got viral infection, let's give him some azithromycin, isn't it? How many times we have seen that happening? And we forget that there is a contradiction in what we are speaking. At one hand, we are saying it's a viral infection, and at the same time, we are giving azithromycin, which is an antibacterial. And the same thing, we get satisfied that if the patient is very sick, or the patient is having um, a very clear cut signs of that it's been infected, without giving a thought, we assume and presume that it's a bacteria, or whether I'm not sure whether we assume there or not, we straight away start with higher antibiotics like meropenem. Many times I tell my students that I don't have problem in you guys starting on a broad spectrum antibiotic or antibacterial, but my problem lies that people stop thinking. They don't try to correlate or try to find out whether this is actually a bacterial infection, or it is anything else, or it's just a bad virus, or whether it's a fungal infection. So hence, my my request to all the people, all the students, is that always try to be mindful of what you're treating and what you are trying to treat. Yes, the most common being the bacteria, sickest one will the bacteria. That's all right. You can start a broad spectrum antibiotic, but don't stop thinking at this place. And if any point of time when you come across this is not a bacterial, try to stop the antibacterial and see whether you need to add any antifungal or antiviral. So with this introduction, I'm just going to broadly classify and broadly have an overview of medically important bacteria, virus, and fungus. It's going to be a bit longish. I may not be able to cover everything, but I will try to cover as much as possible, which is also relevant from the exam point of view. So we'll start with the bacteria. Now, let's look at the structure of bacteria. It's very important that at least we have a bit of a basic idea how the bacteria will be, looks like, and what it has. Couple of things which are very distinct for bacteria is that it's got a peripheral wall, and then you have the internal organelles. This peripheral wall has got a capsule, has got a cell wall, has got a cell membrane, and then we have all other organelles such as plasmid, six pilus, attachment pili, flagella. Then we have nuclear DNA, cytoplasm, and ribosome. The reason you need to know that why these things are there is one, some of them are responsible for entering into the body and stimulate the immune system, which we call it as a virulence factor. Anything? Any question? Yeah. And some of them are becomes what we call it as a virulence factor, and some of them become a resistant factor. So just knowing that these things exist in a bacteria is very important.